What's up, guys? Hi, thank you for logging on to Fever FM. We are about to have a very interesting discussion. My name is Sriram Sulya. I host the superhero show on Fever 104 FM in Bangalore City every day between 5 and 9 in the evening. Now, it is the month of March, and we are celebrating this month of March as Women's Day, of course, Women's Week and Women's Month. But apart from celebrating Women's Day, March month is also marked as Multiple Myeloma Awareness Month, and this is an initiative by Panacea Biotech to raise its awareness of prevention, detection, as well as treatment. The statistics are truly mind boggling. Every year, we find that there are close to about 50,000 new cases of multiple myeloma cancer. Isn't that astounding? So, to help us understand, to help us answer a few questions and clear the air, we have with us Dr. C N Patil. He's a consultant senior medical oncologist with Apollo Hospital from Nama Bengaluru City, who's joining us. Hi, doctor. Thank you so very much for your time.
Hi, thanks for having me on the show.
Lovely. Doctor, let's get straight to it. Tell us, what is multiple myeloma and how severe is it?
Multiple myeloma comes into the diseases of bone marrow. It's a cancer which involves the bone marrow, and it's a quite morbid condition to have. And it's not uncommon. We see a lot of patients of multiple myeloma. It can affect the bones. It can cause fracture of the bones. It can involve the hematological system, causing anemia, low platelet counts, low hemoglobin, and low total WBC counts. And the people are prone for infections, and it can result in renal failure and a lot of other problems. So it's a very serious problem, and we have good treatment for multiple myeloma, and it's important to identify and treat them.
Right. Doctor, what are the trends which you can see in disease incidence and prevalence of multiple myeloma?
If you see, multiple myeloma constitutes about 1% of all cancers, but 10% of hematological cancers. By hematological cancers, we mean blood cancers, lymphoma, and myeloma. So it constitutes 10% of all hematological cancers and 1% of all cancers put together. So it's not uncommon in India, and it's usually disease of old age. It is usually seen in 7th or 8th decade or after the 6th decade. But unfortunately, for unknown reasons, we see it a decade earlier in India. We see it in 5th or 6th decade, and for surprisingly, we do have patients who are in 4th or 3rd decade. So it is an increasingly seen in younger age group in India, and the prevalence and incidence is increasing. The prevalence, of course, is increasing because of better treatment options, and they are living longer. So that's about the burden of disease of multiple myeloma.
Wow. I mean, it doesn't hurt to be as precautious as possible. We'll come to that in just a few moments. But, Doc, what would be the ideal symptoms and how can one recognize if someone has multiple myeloma?
Multiple myeloma, as I told you, generally presents after the age of 60, but we do see patients a decade earlier in India. We can see patients in the age group of 40 to 52. And the most common presentation of multiple myeloma is bone pain. If somebody has unexplained backache after the age of 60 or 50, it should be thoroughly investigated. And it can present to various departments of medicine. It can present to a person, internal medicine person with anemia, and it can even present to a nephrologist with renal failure. And most often it is picked up by orthopedicians because people have back pain or bone pains, and they do go with fractures, unexplained fractures, unexplained bone pain, and unexplained renal failure in an elderly individual, which should raise a suspicion of myeloma. By far, the most common symptom is bone pain, and they can present with fatigue because of low hemoglobin, and sometimes they can present with unexplained infections because their immune system is not effective and they are immunodeficient, and they can present with infections, fever, which is not very common, but the most common presentation is bone pain, that is commonly seen as back pain in age group of 60 to 70 years.
Right. And doctor, usually what are some of the barriers to access cancer care on time?
The most common barrier we see is the lack of awareness. And when they have symptoms, they do neglect, and they tend to self-medicate or seek for over-the-counter medications. And then sometimes the disease is very subtle and the presentation can be very different, and disease can be missed in earlier stages. And lack of awareness is the most important barrier, I would say, in India. But if properly detected and properly worked up, any symptom which is there for more than 2 weeks and not explained by other causes should raise the suspicion of malignancy, especially in elderly age group. The most common barrier is the lack of awareness.
Right. Let's come over to treatment, doctor. How is one supposed to go about it, and what would be the go-to when it comes to treating multiple myeloma?
In the modern era, we have very effective treatments for multiple myeloma. If you see a decade back, the 10-year survival was only 3% in multiple myeloma, which has increased remarkably to 30%. That is 10-year survival, 30% today in this era. And we have very good immunomodulatory agents and modern drugs which can effectively treat myeloma. Myeloma, of course, is not a curable condition, but it can be made as a chronic disease because of the available drugs. And the survival is much more and much longer than what it was a decade earlier. And it is easily treated as an outpatient basis or a daycare basis. Patient need not be admitted in the hospital, and the initial stabilization will be done. And based on their parameters, the regimes are chosen, and most of them would require an injection once a week and tablets every day, and that would control the disease effectively. And after 4 months of treatment, the patients are less than 65 years of age and they are fit and they do not have significant comorbidities, we do what is called as autologous bone marrow transplantation in patients of myeloma, which prolongs the survival and gives good quality of life. So the aim of treatment in multiple myeloma is not cure, but to control the disease as much as possible, to prolong the survival and improve the quality of life. And with the available modern drugs, we have around 10 to 12 active drugs in myeloma, which you will be surprised to know, because we hardly had any drugs 15 or 20 years earlier for myeloma. So we had very basic drugs for myeloma, but the remarkable progress in the science has made us equipped with around 10 to 12 active drugs in myeloma. And of course, the transplant has added to the survival of patients of myeloma. And it can be controlled for a very long time. And the patients sometimes are off treatment for many years, and they do lead a very good life with very good quality of life.
Lovely. Thank you for spending time with us and giving us these insights. Anything that you would like to add in, doctor, before we conclude?
I would say multiple myeloma is not a common cancer, but it is an important cancer which can be effectively treated. So do not neglect any back pain, especially after the age group of 60 years. Do consult your doctor and take appropriate measures. Thank you.
Well, we promise to go ahead and take care of these measures and at the same time observe, raise awareness, and spread the word about Multiple Myeloma Awareness Month, which happens to be this very March. Thank you so very much once again for spending time with us. And these are points that really will help us. You were talking about how lack of awareness turns out to be the biggest barrier. Approaching doing these sessions so that more and more people are aware about it is definitely one way to go about it. Dr. C N Patil, thank you for your time and look forward to catching up with you soon enough. Take care of yourself. See you soon, doctor.